Okay.
Welcome. I am Senator James Gray. Today we'll be having public hearings on House Bills 146, 572, 133, and 503. Before I get started, I will read through the checklist to ensure that the meeting that we are holding is in compliance with the right to know law. As the acting chair of the Health and Human Services Committee, I find that due to the state of emergency declared by the governor as a result of the COVID-19 pandemic, and in accordance with the governor's emergency order number 12, pursuant to Executive Order 2020-04, and its extensions, this public body is authorized to meet electronically. Please note, there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the governor's emergency order. In accordance with the emergency order, I'm confirming that we are providing public access to the meeting by telephone, with additional access possible by video and other electronic means. We are utilizing Zoom webinar for this electronic meeting. All members of the committee and select legislative staff have the ability to communicate contemporaneously in this meeting through this platform, and the public has access to contemporaneously watch or listen to the meeting on Zoom and YouTube and via the phone by following the directions and links provided in the general court website. We have provided public notice of the necessary information for accessing the meeting in the Senate calendar. We are providing a mechanism for the public to alert the public body during this meeting if there are problems with the access. If anyone has a problem, please email remotesenate@leg.state.nh.us or call 603-271-6931. In the event the public is unable to access this meeting due to problems on our end, we will adjourn and reschedule. Please note that all votes taken during this meeting shall be done by a roll call vote. Finally, let us start the meeting by taking a roll call attendance. When each member states their presence, please also state where you are and if anyone else is in the room with you during this meeting, which is required under the right to know law. I will call the roll. Senator Avard.
Senator Avard, here in Nashua in my office. I am alone in my office except for a puppy or two.
Senator Sherman.
Senator Tom Sherman, District 24. I'm in my home in Rye. I am alone in the room, but I have other family in the house who may pass through.
Senator Whitley.
Good morning. This is Senator Becky Whitley. I'm at my house in Hopkinton. I'm alone in the room, but it is school vacation, so my family's in the house.
The chair, Senator Bradley, is at a conflicting meeting right now and will join us as time permits. I am the vice chair, James Gray. I'm here in my office in Concord, and I'm alone in this room. All right. Does anyone have anything before we call the prime sponsor of House Bill 146? No. Okay. Griffin.
Yep, I'll bring the prime sponsor in.
Good morning, Mr. Chair and honorable members. How are you today?
Fine. Yourself?
Great. You can hear me.
Yes, ma'am.
Thank you. And thank you for the opportunity to present this piece of legislation. This bill is pretty simple. It is not a mandate, but what it does ask is that upon the request of a patient who is to receive an injectable, that they can ask for a list of ingredients that is in that injection. And that is the gist of it. It's just making it so that, you know, if you go to the doctors and you want to know what's in, they're saying you need a tetanus shot, you can ask to see what those ingredients are. So I will entertain any questions. It's a pretty straightforward bill.
We have a question from Senator Sherman.
Yes, thank you. And thank you for bringing the bill forward. I'm just confused because we already do that in clinical practice. So I have never refused to provide a list of ingredients or a package insert, which is usually the way it's done. Every medication comes with a package insert, whether it's a vaccine or otherwise. And certainly if a patient wanted to see that before they were given an injection, that's their right and it's already done. So I'm not sure why this bill is necessary.
Thank you, Senator, for the question. I appreciate that. The reason that is because not everyone like you furnishes that upon the patient's request. And sometimes the physician, whoever's administering the injection, may say that they don't have that on hand. And this is just to urge that all healthcare providers or whoever's doing the injection has that information on hand. And it's not a mandate, and it's only upon the request of the patient. So not everybody will ask for that.
You had a follow-up, Senator.
Can I ask, have you or any of the other people bringing the bill forward ever reached out to the Medical Society or the Nursing Society, since they cover virtually all of the providers in the state of New Hampshire, and talked about doing something non-statutory that would make it sort of standard of practice, which it is in our practice. We have 140 plus physicians, and nobody would dream of refusing to give a patient the information prior to an injection. That's a patient's right already. So have you reached out to any of the two societies, nurses or the Medical Society, on this one?
I have not.
Okay, thank you.
And any additional questions from committee members?
No, thank you. My questions were similar to Senator Sherman's about whether this is an issue that happens right now in New Hampshire. But I think the representative answered it. Thank you.
All right, thank you. Griffin, thank you, Representative.
Thank you very much. Have a wonderful day.
All right,
Next up, I have a John Gay from Casella Waste Systems signed up to speak, but I do not see him in the attendees list. Other than that, those are the only two people I had signed up to speak on this bill. If there's anybody else, please raise your hand or press *9 if you're on the phone.
Griffin, was John Gay opposed?
It indicated he was in support.
Okay.
we can afford to give him a couple of minutes. If he's the last one to testify, we'll ask for any hands of anyone else that's on the call that does want to testify on this. And since our next meeting is until 9:15, we do have a couple of minutes to wait.
Senator Gray, may I ask if other people had just sort of signed in support or opposed, but didn't want to speak?
I haven't been able to log into my computer here at the State House yet. I'm trying to do that. But Griffin, you probably have the list there. You can tell us.
Sure. So I have 10 people signed in support, 3 signed in opposition. 3 in opposition are Elizabeth Sargent from the New Hampshire Society of Health System Pharmacists, and Amanda Morrill, who I believe says she's a pharmacist, and then a David DiPiero.
Also, Jim, apparently Mr. Gay signed up on the wrong one. He meant to sign up on a different bill, and that's why he's not here for this one.
Then we shall close public hearing, and we will be in recess until 1:15.
Great.
Okay, I think my clock just crossed over to 9:15. The next bill is House Bill 572. And Griffin, do we have the prime sponsor on the line?
Yep. Representative Merchant's here.
Thank you, Griffin. Good morning, Mr. Chairman and members of the Senate Health and Human Services Committee. For the record, I am Representative Gary Merchant, representing Sullivan County, District 4, Claremont, Ward 2. I come before you today to introduce House Bill 572. 572, as amended, passed the House Health and Human Services and Elderly Affairs Committee with unanimous vote of 19-0, was passed on the consent calendar and passed the full House on a voice vote. RSA 318-16B includes ambiguous language regarding administration of flu vaccines to individuals under the age of 18. This bill clarifies that a pharmacist may only administer a vaccine to an adult 18 years of older. Pharmacists currently provide 12 of the 14 vaccines on a Centers for Disease Control Prevention, CDC, recommended adult immunization schedule. House Bill 572 enables a pharmacist to give the remaining 2 vaccines, allowing greater access for patients to all CDC recommended adult vaccines. Patient utilization of pharmacists for vaccines has grown significantly in the past few years. House Bill 572 enables fully trained, educated, licensed advanced pharmacy technicians to administer a vaccine, allowing safe use of cost-effective personnel to assist pharmacists. I do recommend to the committee to review line 24 and to think about a revision. House Bill 221 would have changed the RSA regarding the vaccine registry from an opt-out to an opt-in. The bill came to the full House with a committee recommendation of ITL. Because of time constraints, the House took no action on the bill. Line 24 on House Bill 572 was written to allow a pharmacist to comply with the registry requirements regardless of the outcome of House Bill 221. As House Bill 221 was not passed by the House, it is my recommendation to this body to modify the language in House Bill 572 to reflect the current law is to opt out. And that's basically my testimony before the Senate on House Bill 572, and I open it for questions.
I saw Senator Sherman first and then Senator Whitley after. Senator, you may want to unmute. We would.
Lip reading.
All right.
That helps. Thank you, Senator Gray, and thank you, Representative Merchant. As I do have language both from the Department of Health and Human Services as well as from you on an amendment to that section, line 24. And there's also been some concern raised about making sure that primary care providers are involved in the process of vaccination, just from the standpoint of making sure that people are not vaccinated twice for the same vaccine. And what you're adding are vaccines that are series vaccines rather than single vaccines. So would you be willing to participate in a very quick working group to just make sure that the final amendment is one that everybody is happy with and moving forward as to address those 2 issues?
Yes, Senator, I would be glad to participate in the group. I think when we get stakeholders together collectively, when there's an issue, it ultimately leads to better legislation. So yes, I would be in favor of supporting that recommendation and also to participate in the group.
Great, thanks.
Okay. Senator Whitley.
I'll hold my questions. Thank you. Sounds like we have a work group that's going to address the issues. Thank you.
Okay. Are there additional questions for Representative Merchant. Seeing none, thank you. And Griffin?
Next up, I have Dr. Melissa Duxbury. Give me a second here.
Can you hear me?
Yes, we can.
Okay. Hi, I'm Dr. Melissa Duxbury. I'm a family practice medicine physician for the last 20 years in Hudson. I have some concerns about this bill. Can you still hear me okay? Something's happening on the Zoom.
We can hear you
Okay.
fine.
I have several concerns on this. I myself have had some personal issues in the fact that I've been transitioning from one group to the other. And even with all of that intact, the difficulty in keeping track of series vaccines, I thankfully know most of my patients for 19 years, so I know oddly who has and who hasn't had which vaccines, but going through a pharmacy where we do not yet have a working functional state vaccine registry is very, very rife for problems. I've had several patients who've been vaccinated more than once where they've had their vaccine at the pharmacy.
And we did lose you that time. Melissa, are you back?
Most of my patients that I know who are pharmacists also have concerns themselves, is they're very stressed already on a very busy
Melissa?
day, and vaccine schedules are difficult. Yeah, can you hear me?
Well,
Can you hear me?
You dropped out for probably 10 seconds or so back
Okay.
to your testimony. You may want
So-
to turn off your video. Sometimes that
Okay.
helps people to get the bandwidth
That
they need to get
helps.
the
I
audio.
don't know. See if I can. I think I just need to, can you hear me still? I'm so
Yes,
sorry.
ma'am.
Can you hear me? Okay,
Yes,
so I'm just gonna, my husband is driving. I'm actually trying to do 3 things at once, but I'm gonna pull over here. So you can hear me okay here?
Yes.
Right now we can.
Okay, sorry, that's how important the bill is. I'm gonna have us pull over. So, because my husband's on his way to get his vaccine. So, it's very important to keep our patient relations good with having, being able to vaccinate. Most of the time, that's how we find out that we get them for their annual visits. But I also have a lot of concerns in the fact that we don't have a really well-run, well-functioning state vaccination system. And it is no small thing when patients have vaccine reactions. For one, they're very far away from a healthcare provider with, the ability to adequately, if you have a severe reaction, which we've seen a few of, and some of the sites at the vaccine rollout. And thankfully they've had, first aid providers, but they've also had all of the military and PAs and the people that we have able to do that in an office is very different than the people that we have able to do that at a pharmacy. And I think the biggest thing for me is that it disconnects care. We have a patient's care similar medical home where I don't think that patients
Melissa?
Senator, if you'd like, I can email her and see if she might be able to submit written testimony if you'd like.
Well, how many more people do we have on the list for this bill?
4 more speakers on this bill.
All right. Can you mute Melissa?
Yeah, I think we actually just lost her. So, but I believe she might have provided an email address. I'll check and I can follow up with her that way.
All right. Since we know she was on a cell phone, you may be able to text her and tell her, briefly what happened.
Sure.
All right. Greg, if you would call the next witness, I would
Yep.
appreciate it.
So next person I have signed up to speak is Paula Minnihan. Paul, oh, she raised her hand. Hold on, I gotta go back up to the list.
Morning.
Paul. Good morning, Paul.
Hi, how are you all? Good morning, Chairman, members of the committee. For the record, my name is Paula Minnihan, Senior Vice President, State Government Relations, New Hampshire Hospital Association, representing all our hospitals. I did not submit written testimony. I do understand that there will be a subcommittee. We did sign in an opposition to the bill as amended. We have concerns regarding what Representative Merchant identified relative to the opt-in provision. That is not something that we support. We believe the opt-out position, the opt-out provision in the current law is appropriate, and we are happy to participate in the work group that Senator Sherman and Representative Merchant are setting up. So I'm happy to answer any questions, but that's really the extent of my testimony.
I'm sure that Senator Sherman has written your name down on his working group list.
Great, thank you very much.
Questions from committee members? Senator Avart.
Thank you, Mr. Chair. Hi, Paula. Just a quick
Hi.
question. You said opt-out is already current law?
Correct. Yes,
Thank you.
you're welcome.
Additional questions? All right, thank you very much. And Griffin?
Next person I have signed up wishing to speak is Dr. Joanne. I'm going to butcher the last name, so I'm just going to say Dr. Joanne B.
Bunamano?
Yes, Buonamano. Good morning.
Good morning.
I'm not sure if I'm on video or not, but
No,
so
you're not.
okay. I'm a family doctor. I've been in the state since 1995. I'm the current chapter president for the New Hampshire Academy, and I'm the CMO at a Seacoast FQHC and on core faculty at our brand new residency program in Portsmouth. We are blessed to have a 340B pharmacy right in our building, and we really strive to integrate pharmacy staff into primary care. Congratulations to the state on getting a registry, finally. That is critical to moving forward. Our staff are doing duplicate entries right now. We give vaccines because there's no connection to the EMR. We have to duplicate enter. So there still is a lot of work to happen on that registry. Currently, vaccines that the pharmacies give, only 10% or less are getting transmitted to the patient-centered medical home or to primary care. So I totally endorse pharmacies giving vaccines. I've gotten my flu shot at CVS myself, but more complicated vaccines, even Shingrix and the Pneumovax, we really need to be thoughtful and follow the standards of care. I think that vaccines need to be given in the context of a patient-centered medical home. Like we talked about, they need to be properly documented. The same way that you would document any medication, we don't give meds and not properly document them in the patient's chart and historical material. So our commercial carriers, our Medicaid carriers, they fully expect that primary care clinicians have this data. We are responsible for the data, and it is important to population health, as we are seeing now how vulnerable we are as a population in this area. Our EMRs have complex algorithms that trigger reminders and indications based on a patient's medical history. And that becomes part of their care plan that we're responsible for. And, you know, primary care, we strive every day to overcome these barriers in a fragmented healthcare system. So we want to bring the pharmacists onto our team. We don't want to fragment our team even more. We want the pharmacies to come in and be part of primary care. I have concerns about the bill on several of the vaccines that it brings up, because it shows a misunderstanding of adult, young adult vaccination, particularly age 18 to 22. Quadrivalent and monovalent meningococcal vaccine administration is dependent on historical knowledge of prior vaccinations and knowledge of that young adult's risk factors. Colleges and places of employment are very strict on what they require for documenting all vaccines, but particularly the meningococcal vaccine. And we have to follow best safe practices. Several colleges have gotten hit with horrendous meningococcal outbreaks. We need to keep track properly in patients' records. The monovalent vaccine, particularly the group B series, you cannot cross series on that, cross brands on that. Once you start with the brand, you've got to give the same brand. This requires detailed documentation and really mandatory reporting. If you're going to give that vaccine, it's got to be listed on the registry. The MMR, the Hep A and Hep B and varicella vaccines are also part of proper college documentation and employment documentation if you're working with children. That too, you need historical knowledge of what a patient's prior inoculations have been so that you can properly give the patient the right dose at the right time and not be wasting resources and putting the patient at risk. The guidelines are very clear on this. Several of these vaccines, particularly MMR, you need to look at serology. You need to look at blood work and see if they have proper antibodies. If they do, they don't need a booster. So this really involves complex, medical decision-making and shared decision-making that having the pharmacy on the team is helpful, but they are not really trained to make that decision without the proper records and information and without being part of a primary care medical home.
Senator Avard, you have a question.
Yes, thank you, Mr. Chair. And thank you for your testimony, Dr. Buonamano. With regards to, you said that there's no connections with the EMRs as far as proper documentation. And so I assume that with the pharmacies, the same problem happens, that there's no historical documentation to give an informed vaccine.
Well, let me share with you what should happen is the pharmacy gives you a sheet, and I think they do a great job, but documenting your vaccine, and that needs to get to the primary care provider so it can get registered in their chart and get put on their immunization registry in the chart. Because we're getting pop-ups all the time. This patient's due for this, they're due for that. So we need to have them as part of the team. So in my opinion, if the pharmacy is going to be administering a vaccine, it needs to be mandatory so that the reporting needs to be mandatory so that the primary care team can look at that and have a competent evidence-based care plan for taking care of that patient.
Yes, sir.
So under current procedures, the reporting is not mandatory. Is that the problem with the bill?
The reporting is not mandatory on the bill, and the registry is brand spanking new for the state. So as I mentioned, my medical assistants and nurses are having to duplicate enter. So they're entering the vaccines they give in the patient's chart, then they have to go onto the registry and duplicate enter. So we need more time to really be thoughtful and follow best safe practices for integrating pharmacy into the primary care team.
One final follow-up, if I may, Mr.
Sure.
Yes, Senator.
So with regards to the registry, that's already in existence, and if so, who has access to that?
The registry, I believe, is 2 weeks old or less. And we are just signing into the special account to be able to have access, but there are a lot of problems with it thus far. So it certainly is not, where its potential is meant to be.
with regards to the who has access to it?
Right, getting access to it. I think we're ahead of the game. We're a federally qualified health center. We're used to all sorts of federal reporting. So our team is on it. We're in there and doing what we need to do. But I have talked to several other practices. They are not registered yet.
Thank you.
And I don't think the pharmacies are registered. I'm not sure on that, but.
Okay, thank you, Senator. Are there additional questions? Seeing none, thank you.
Thank you. Have a good
And
morning.
Griffin?
Next I have is Courtney Tanner.
Ms. Tanner?
Good morning, Chairman Gray and honorable members of the committee. Thank you so much for letting me testify. I will be so very brief. For the record, Courtney Tanner, I'm the Director of Government Relations at Dartmouth-Hitchcock. Dartmouth-Hitchcock supported House Bill 572 as originally introduced. We believe that expanding the pharmacist's ability to administer all CDC-approved vaccines will increase access for patients. We do have significant concerns about House Bill 572 as it passed out of the House. As Representative Merchant noted, this House Bill 572, as currently drafted, does include opt-in language for our state registry. And as the Hospital Association testified, we too also have significant concerns as we are working very hard to stand up our new opt-out registry. We believe that's the way the state should be going. It's my understanding that there will be a work group, and I'm actively raising my hand to participate in that work group, Senator Sherman.
Okay.
I'm happy to take questions, Senator Gray.
Are there questions from committee members? Seeing none, thank you very much.
Thank you.
And Griffin?
Last person I have signed up wishing to speak is Abby Rogers from HHS.
Okay, while Abby Rogers is unmuting, everyone else on the call that wants to speak, please raise your hand, because if we don't see any hands at the end of Abby's testimony, then we will close the public hearing.
Great. Good morning. This is Abby Rogers. Good morning, Senator Gray and members of the committee. For the record, my name is Abby Rogers. I'm the legislative liaison for the Division of Public Health Services. I am also going to speak very briefly. We had concerns, as everybody else has expressed, on line 24 around that language, and it looks like we'd like to thank Senator Sherman for his help to address that, and also Representative Merchant for addressing that as well. We'd be pleased to participate as well in a work group on that language. And that's all I had to contribute.
All right. Well, Senator Sherman, Dr. Senator, well, we'll give them all.
AU works. Abby, thank you so much for testifying, and we will add you to the list. There have been lots of questions about the registry, and is it possible to just give us a 2-second update on where it is right now?
I am not privy to the most recent update. I work with infectious disease, but not on a daily basis. I can tell you that it's moving along, and I know it is, as the previous person who testified, the physician, that it is moving along and 2 weeks old. I did recognize her concerns, and I would be happy to arrange, if she'd like to speak with Beth Daly or someone in the Bureau, I certainly can arrange that. And I don't have a more significant update than that at this time. I'm sorry.
Quick
Yes.
follow-up.
Yes,
So is Beth the one who's in charge of the rollout?
She would be the best resource on that. Yes.
Thanks.
You're welcome.
Okay, additional questions? Seeing none, Griffin, did we get any hands during the testimony?
I see no hands raised for anybody who wishes to testify on House Bill 572.
Okay, well, I'll close the public hearing on 572. And if you're ready, we will open the public hearing on House Bill 131.
1 second here. Prime sponsor is Representative Gary Woods.
Good morning. Can you hear me?
Yes, we
Yep.
can.
Good. Thank you, Mr. Chairman and committee members. I'm Gary Woods, representative for Merrimack District 23 for the towns of Bow and Dunbarton. I'm here to give full support to House Bill 131, which came out of committee as ought to pass 17-3, and it passed the House on a roll call vote of 230 to 130. I sent out some of my notes, which you may have gotten last night, but I'll review it very briefly. In essence, this bill updates, clarifies standardization rules, and helps relieve some of the administrative burden of both the DHHS and the facilities which they review. In section 1 of the bill, on lines 4 and 5, if you have it in front of you there are stricken 2 measures which are currently had been in place. That is adherence of central line insertion practices and surgical antimicrobial prophylaxis. Turns out that over the course of several years, the facilities that were being reviewed had maintained a 95 to 98% compliance. And after that time, it was felt they no longer needed to report. That means go through all the administrative problems of getting the report in. But during site visits, these will still be reviewed. So that these areas during actual on-site visits will still get scrutiny. This lowers the administrative burden of the facility, but still maintains vigilance during on-site reviews. Also in section 1 is the continued reporting of influenza vaccination rates. There was a little bit of concern about what that entailed. And just to reassure you that this is aggregate data only. It does not in any way mandate vaccination, and it's completely depersonalized data. Availability of this data allows DHS to reliably comment on the health status in this sector of healthcare related facilities. This information in turn helps DHS discharge its responsibility to inform and formulating recommendations for the general public in New Hampshire. In section 2, lines 14 to 16, there's highlighted several prominent national and federal agencies. These are included as standard bearers in the areas for facilities such as hospitals, nursing home facilities, residential care, ambulatory surgical centers. These are the leaders in these areas. Again, this does not require that the protocols established by these organizations mirror that the state protocols don't necessarily have to mirror the national organization verbatim, but simply identifies the standard to which the protocols established in New Hampshire should conform. Again, this last point is emphasized in the language in lines 18 to 20. Regarding the addition of the term measures, there was 2 places that it was added, lines 12 and 24. There were some concerns that this was expansion, and there was concern that this was perhaps an overreach. However, this is just consistent with other areas of the New Hampshire RSA, and also makes the review process consistent with federal law. And I've cited the federal law that this must comply with. This in no way expands the current review mechanism, nor does it increase areas to be reviewed beyond what is currently in place. Lastly, there's alterations in line 28 to 31 by strikeout, additions and deletions. This is simply serves the sole function of bringing the titles of these entities up to their current designations. So in essence, this bill does not really add anything, does not subtract anything, but simply brings things up to date, consistent with national language, and provides a standard by which the state can continue to do its job of keeping the citizens apprised of the health in these particular areas, and therefore apprised of any new measures that might be needed. Thank you very much. And I'll take any questions, and I'm sure there's others from HHS and the Hospital Association that may be able to answer very detailed questions if needed.
Questions from committee members? Seeing none, thank you very much, Representative Wood. And Mr. Rover.
Sure. Next up, I have Alyssa Malcolm.
Alyssa.
Good morning.
Good morning.
So I am Alyssa Malcolm. I'm the Director of Value Reporting and Analytics at Dartmouth Hitchcock. My role includes responsibility for all of the external quality reporting for Dartmouth Hitchcock, including infection reporting to the state of New Hampshire. Additionally, since 2011, I have been a member of the Healthcare Associated Infection Technical Advisory Work Group, which provides scientific and infection prevention expertise to the HAI program. I have been speaking in support of this bill, and I believe written testimony has been submitted as well. I support HB 131. Not only does it allow for the state to use the rules process to stay current with scientifically valid measures, but also reduces the reporting burden for hospitals. Both the state and the hospitals have struggled for years on how to meet the CLIP, so that's central line insertion practices, and SCIP requirements. And SCIP stands for Surgical Care Improvement Project, and it's a group of infection prevention process measures. For the better part of the last decade, in the Technical Advisory Work Group, we've been talking about how to address the concerns with the CLIP measure, both its weakness as a metric and its time-intensive nature to report. It's a low-value measure. I want to stress that the concept of CLIP is good. So the idea of a bundle of actions to prevent patient harm is really important, but I would argue that what CLIP measures is our ability to document what has become standard practice for line insertion. On the SCIP side of things, CMS retired the measure 6 years ago. Nationally, the measure had topped out, meaning the performance was so high and the distribution was so tight that meaningful distinctions between hospitals could no longer be measured. Hospitals cannot continue to abstract measures when the definitions are no longer being maintained by measurement scientists. It serves neither the citizens of New Hampshire nor the hospitals whose performance is on display. This bill fixes both of these measures. Furthermore, you'll note that those are both process measures. They focus on steps in the process rather than the outcome or the result of the care that is provided. For years, CMS has been placing heavy focus on outcome measures and moving away from process measures. HB 131 helps line up the state with CMS current practices and allows the state to be flexible as infection measurement changes over time through alignment with the CDC, CMS, and National Quality Forum. I really would like to acknowledge the work of the Healthcare Associated Infection Program at DHHS to address the issues with CLIP and SCIP. They've brought modifications to the rules process in 2019 so that CLIP can now be entered into a survey tool rather than line by line information about each and every line inserted in intensive care units. For my hospital alone, this saves us about 8 hours a month of an analyst hand entering data on line insertion. So the rules change also allows for hospitals to submit SCIP data via survey if the hospitals are tracking it. These efforts are hugely appreciated and are all that the HAI program could do with CLIP and SCIP, explicitly being included in RSA 151.33. HB 131 cleans this up and gives the state the flexibility they need to stay current with scientifically valid measures. Thank you all for your time this morning. Thank you, Senator Gray, for giving me the opportunity to speak, and to Representative Woods for sponsoring this bill. Are there any questions that I can answer for you?
Questions from committee members? Seeing none, thank you very much.
Thank you.
Does anyone want to raise their hand?
Senator, I got Paula Minnihan signed up wishing to speak.
All right, as soon as Paula's done, if your hand is not up, we're going to close the public hearing. Paula.
Good morning, Mr. Chairman, members of the committee. Again, from the record, Paula Minnihan, Senior Vice President, State Government Relations with the New Hampshire Hospital Association. I will be brief. Alyssa did a great job, as did Representative Woods. We are in strong support of HB 131. I did submit written testimony, which I will not go over at this time. But I did want to, again, acknowledge that Representative Woods did introduce this bill last year, which we were very appreciative of. It did pass the full House, was heard actually in your committee last year, but ultimately did not get signed into law due to the pandemic issues that we dealt with. The bill language before you includes the exact same language that did pass last year. So I just wanted to make that clear. I think all my other points have been made by the previous speakers. And we, again, are in strong support of this. Happy to answer any questions and appreciate very much the opportunity to for you to consider and support this bill, hopefully.
Questions from committee members? Seeing none, thank you very much. Griffin, do we have any hands?
So I did have Katrina Hanson signed up wishing to speak from Department of Health and Human Services. So I'll bring her in.
Yes, please.
Good morning, members of the committee and Senator Gray. Can you hear me all right?
Yes, we can.
Thank you so much. My name is Katrina Hanson, and I am the Chief of Infectious Disease Surveillance Section at the Division of Public Health Services. I'm here today to provide information in support of HB 131. I did submit a written testimony which provided more details regarding healthcare-associated infections and the burden, but due to the prior speakers and their detail, I'm going to skip to some of the more relevant details. Few states require and monitor central line insertion practices, and we do support this bill because of that, and that is no longer a nationally collected measure for other organizations, for example, CMS. Monitoring clip data is very burdensome for healthcare facilities, as you heard from Alyssa Malcolm. It also requires manual data entry for every insertion that occurs. And though clip data was useful originally in understanding the adherence, it is now less relevant as healthcare landscape has changing. Additionally, CLIP is not used routinely by the HI program to provide recommendations or feedback to hospitals for quality improvement. Surgical antibiotic prophylaxis data via the SCIP measures have not been available since 2014 and are no longer a national quality measure. Going forward, New Hampshire hospitals would have to report this measure through a different mechanism to DHHS, such as through an online survey, but that would still be burdensome. This measure has less utility, and the HI program would like to focus efforts in working with facilities to collect more meaningful data to measure antibiotic resistance and stewardship. And thank you for the opportunity to testify. Thank you, Senators Gray, and thank you, Representative Woods, for the bill. I'd be happy to address any other questions you may have at this time.
Questions from committee members? All right, thank you very much. One last chance for anyone to raise their hand. Seeing Griffin not saying we have somebody.
I'm not seeing anybody.
We'll close the public hearing on House Bill 131. And as soon as you're ready, we'll open the public hearing on 503.
I will bring in the prime sponsor, I believe is Representative Pat Long.
Representative Long, good morning.
Good morning, Chairman Gray, members of the committee. I'm Representative Pat Long, representing Hillsborough District 10 within the city of Manchester. The House Health and Human Service and Elderly Affairs Committee moved to set up the Governor's Council on Housing Stability and Statute. So House Bill 503 was amended by Representatives Marsh and Shapiro to include the Governor's Council on Housing Stability and some of the components in the original House Bill 503, specifically as it pertains to unsheltered or unhoused. House Bill 503 is an attempt to get the pulse on homelessness in the state of New Hampshire. As I go through my testimony, I break down homelessness into two categories. Homelessness, in my opinion, is those living in the state with nowhere to call home. They share housing units with other families, live temporarily with family members, or they may couch surf. The other category is unsheltered or unhoused. Those are people living in encampments throughout the municipal property throughout the state, normally in tents. Today, I believe each municipality dealing with homelessness are in their own silos attempting to find solutions. Often those solutions are in addressing immediate needs, as in unhoused winter shelters. Several municipalities have leased spaces temporarily for people to have a warm spot when the cold weather becomes too dangerous and remaining outside. These encampments have proven to be dangerous to both the unhoused and the neighborhoods that they currently live in. In March of 2020, when COVID-19 hit, the unsheltered population in several cities increased substantially. People were afraid to take people into their homes, and the unsheltered were resistant to going into shelters. Currently, there are several funding mechanisms that the state of New Hampshire receives in federal dollars passed through the state. And I refer a letter responding to about 13 mayors in New Hampshire from the governor, with which there was the state had passed through $40 million in 4 years. So that's approximately $10 million a year. So I believe that the passage of House Bill 503 will immediately allow this council to ensure public dollars are being expended at its highest level in best practice solutions recommendation. In December, the Council to End Homelessness released an annual report in the state of homelessness as reported in New Hampshire Business Review titled "State Study Sounds Alarm on Homeless Tidal Wave" in their January edition. The good news is there is no studies that need to be done. We have all we need to begin immediately addressing best practice solutions. This addition to the council through their expertise can affect best practice positive change immediately. The governor, to his credit, has established this council on housing stability, which I feel is imperative in moving our homeless forward. However, I haven't spoken to many people in encampments that would be able to afford an affordable house, affordable apartment unit. So the meetings that I have attended lean more, the meetings of the council that I've attended lean more towards affordable housing. And again, that is a very important issue. I am of the opinion affordable housing will not address the unsheltered would not address the unsheltered. Again, speaking just within Manchester, outreach workers have identified over 80% of the unsheltered have underlying mental health service needs, and the percentages increase when you include substance use disorder. These needs are imperative prior to addressing any services on independent living. In closing, we have implemented the tools in addressing mental health and substance use disorder with the 10-year mental health plan and the Doorway program. What we need now are our experts to agree with the initiatives in stopping this tidal wave of unsheltered and homelessness in the state of New Hampshire. And to close, with respect to this, the Council on Housing Stability had approximately 39 members as of December, 36 or so members, with 6 members that were unfilled, so bringing it a total of 42. So this, adding the components of the original House Bill 503 adds another 4 components. And actually on pages 3, line 30 starts what they added of the original House Bill 503. From page 3, line 30 to page 4, line 8. And with that, I'll entertain any questions, Mr. Chairman.
Questions from committee members? Senator Avard.
Thank you, Mr. Chair, and thank you, Representative Long, for bringing this forward. You mentioned the Doorway. What is that?
The Doorway is a substance use disorder, which has, they're set up in regions in Manchester, in the greater Manchester area. It's CMC. It's an 8 to 5 place for people to get help for substance use.
Thank you, sir.
Additional questions from the senators? Seeing none, thank you very much, Representative. Mr. Roberge.
I will bring in Chris Santinello from the department.
Morning, Chris. Well, you were muted, unmuted, and then muted, and back to unmute now. All right, good.
Now, can you hear me?
Barely.
Okay. All right. Let me just put my headset on then and see if that's any better. Can you hear me better now?
Yeah.
Okay. Whoops. Just a little.
I think it's that you moved a little closer to the microphone.
I know. It's one of these days I'll figure it out, and hopefully by then we'll all be in person, right? So
Yes,
good morning, and thank you for allowing me to speak on behalf of House Bill 503. First of all, I appreciate fully the focus on homelessness and housing instability within the state of New Hampshire. However, at this time, the department respectfully opposes House Bill 503. And I just want to give a couple of reasons why. I believe when this original bill was submitted, there was a need to focus on individuals experiencing homelessness and those facing housing instability. While there is still a need to focus on this population, since that time, a significant amount has gone and focus has gone into further efforts within the state. In November, like Representative Long mentioned, the Governor Sununu signed Executive Order 2020-22, which created the Council on Housing Stability. House Bill 503 as presented, while it does codify the executive order, it expands membership and adds to the scope of the plan on homelessness. There's a few problems with this and why we at the department oppose this. It is duplicative of the executive order at this time and not necessary. It adds more people to the council, and right now the structure already has 41 members, and some of the additional recommended appointees are duplicative of current representation. It'll actually slow down our work, which I don't think anybody wants to do right now. We have already begun work on a comprehensive plan to address homelessness, and this is due to be completed in June. And as part of that work, there's 4 primary work groups working towards a goal to increase housing stability and decrease homelessness. And one of those groups is looking at the actual plan to create homelessness, and that includes the case management. As we all know, that's a critical piece to all of this work. And within those work groups, there's an additional approximately 80 people active on the work groups. And some of those are not council members, but people that are committed to this work. And the work group that is tasked, they've been putting countless hours on this plan and is presenting actually a framework next week, which is next month, to the full council. And changing midstream will delay, I fear, the completion of this important plan. The council, with philanthropic support, has the support of consultants, the Corporation for Supportive Housing, who is assisting us in the development of a plan. And this plan will be submitted by the end of June and will outline what the council has achieved, what still needs to be a focus, recommendations to increase housing stability, and a plan for homelessness. And then the way the executive order currently reads, each November, the council is required to review the plan, the work being done to increase housing stability and decrease homelessness. There is no end to the executive order or the work of the council. So changing the council at this time is not necessary. I think it'll strain staff resources, which will not help us to solve this problem. And I would just ask that the council be allowed to complete the next stage of the work as planned. And then if we need to put something into legislation, do so at that time. And in closing, I thank you for your time, and please do not hesitate to contact me with questions.
Just to be clear, the executive order, I think you told me it was 2020-22.
Yes.
Okay, Senator Avard.
Thank you, Mr. Chair, and thank you for your testimony. You said that there were 41 members and there was some duplicative people on that are being proposed. Can you give me a couple examples of the duplication of members?
Sure. So one of them is recommending somebody from NAMI, New Hampshire, but we already have a community mental health center director. It also lists somebody from Fit New Horizons, but we have somebody from that organization representing the Fit as well as the council on homelessness. So we went through and made sure we had all areas covered.
Follow up. So if it seems as though NAMI is in support of this, though.
They may be, and which is fine. I just think adding more people at this time, 41 people is a pretty comprehensive group of people. And so one of the things we've talked about with the council is looking at the membership and structure after our initial plan is done to see who is needed to help us carry out our work in the future.
Okay, thank you.
You're welcome.
Additional questions from the committee members? Seeing none, thank you very much.
Great, thank you.
Griffin?
So next I have Alyssa Margolin.
Good morning, Senator Gray, members of the committee. For the record, my name is Alyssa Margolin. I serve as Director of Housing Action, New Hampshire. We're a statewide organization of 80 organizations united around affordable housing policy and ending homelessness in New Hampshire. We count among our members homeless service providers. We are neutral on HB 503, but I thought I would just provide some context for the committee. When the COVID-19 pandemic hit, it was a very scary time for those in homeless services. Everyone has their own microcosm of the experience, but for those of you who have visited a homeless shelter, you know it's basically a big room with bunk beds 2 feet apart. And for those experiencing unsheltered homelessness who get day services through homeless service providers, as stay-at-home orders and businesses and libraries and restaurants shut down, the intersection between seeking out bathroom facilities to support daily life became very difficult. So there was a lot of courageous leadership and work that happened at every level, at the municipal, the organizations at the state level. And we were able to implement a shelter modification program that supported decompression sites that allowed us to lower the census inside the shelter and address operational needs. The department was also successful in securing additional relief resources to allow for quarantine and isolation in the case of infections. New Hampshire actually did pretty well compared to some other states, as I've discovered. However, we did see an increase in unsheltered. It alarmed many municipal leaders. Around that same time was LSR deadlines in the House, and we saw a flurry of proposals for new study commissions addressing homelessness. And then on, I believe it was November 18th, 2020, the governor established this new Council on Housing Stability, replacing the former governor's Interagency Council on Homelessness. A lot of this was happening simultaneously. And so in a way, it looks like we're retrofitting initial proposals on leadership and coming together when this new one is now already in play. And so that's the context I want to provide the committee. Again, Housing Action New Hampshire is neutral on the bill. Happy to take any questions.
Questions from committee members? Seeing none, thank you very much. Griffin?
Next and last person I have signed up to speak on this bill is David Till.
All right. Before you get started, David, if there's anyone else out there that wants to speak on this bill, please raise your hand while David is speaking, because we will close the public hearing soon after. All right, David.
Thank you so much, Chairman Gray and members of the committee. I'm David Tilley. I'm Director of Veteran Services at Harbor Care and testifying in support of HB 503. And it's great to see Senator Jeb Bradley. It's David Tilley with Harbor Care. And,
David,
how are you, sir?
I'm good. I owe you a phone call. I apologize.
Oh, no problem at all. No problem at all. I'm just testifying in support of HB 503, codifying the Council on Housing Stability established by the Governor in Executive Order 2020-2022. Harbor Care serves as a designated member on the Council on Housing Stability. First, I'd like to note a small modification / correction to section 4-H2 membership, Section 2. Additional members are appointed as follows. F to read. It reads now one representative of Harbor Homes, Inc. appointed by the organization, and it should be corrected with one representative of Harbor Care, Inc. Harbor Care is the new shared name of Harbor Homes, Keystone Hall, Healthy at Home, Harbor Care Health and Wellness Center, and the Southern New Hampshire HIV/AIDS Task Force. The name Harbor Care more accurately reflects the scope of our high quality services, including supportive housing, healthcare, mental health care, substance abuse and use, and veteran services, home care, and HIV/AIDS services. I'd like to mention too, Harbor Care has been at the forefront on working on ending veterans homelessness. They reached that certification of effectively ending veterans homelessness in 2017, and we're working very hard to achieving that on a state level. We're also very close with regard to chronic homelessness in the greater Nashua area. Some areas in homelessness around veterans homelessness, we have resources but need assistance with landlords and also with, in particular, handicapped accessible housing for our veterans. And also through the pandemic, Harbor Care has operated nonstop. We never had a closing, although there certainly have been challenges through the pandemic, and we've been very fortunate too that we have not had any serious outbreaks at our BAE facility. For example, in Manchester, we had no COVID cases, and we've had very high percentages in the 90 percentile up range on those that we serve that have been vaccinated. And just wanted to mention again, we strongly support HB 503 for the purpose of creating and implementing a plan to create housing stability for all of our citizens in the state of New Hampshire, and very much thank all of you for your time and consideration, and am happy to answer any questions. Thank you.
Go ahead, Jim.
Senator Avard.
Thank you, Mr. Chair, and thank you, David, for your testimony. You strongly support this bill, but the DHHS says that this is maybe a overkill, if I can put those words in their mouth. Why do you think this is so important with this commission?
Well, I think from Harbor Care, or from my perspective too, actually, we're very pleased to see the state and the governor putting such a high priority around the issue of homelessness and housing stability. And whether it's through this council or other entities that we serve on, we're very pleased to see this effort being made.
Thank you.
Additional questions from the senators? Seeing none, thank you very much. And Griffin, did we have any hands during the testimony? You're muted, Griffin.
There we go. Okay. I don't see any other hands raised. I don't see anybody else wishing to testify on this bill.
Okay, well, thank you very much. And we'll close the public hearing on 503. I would like to go into executive session just to discuss the bills we had today and clean up anything else, if that's acceptable to the chair.
So moved.
So Senator Avard moves.
Second.
Second by Senator Sherman. And Senator Bradley, do you want to call the roll since you're the chair?
I'll take over from now. Thank you very much. Apologies. Wednesday seemed to be just a really busy day. So Senator Whitley.
Yes.
Senator Gray,
Yes.
Senator Avard,
Yes.
and Senator Sherman.
Yes.
And I vote yes. And for the right to know, I'm in the third floor Senate offices. So,
Just to recap for you, Senator.
thank you.
House Bill 146, Senator Sherman had some questions about whether or not it was common practice to provide the information that the bill would provide. I think that maybe we should at least take a week on that and see if there's something already out there, or there's a rule somewhere or something that that requires that information to be provided already. The next bill that we heard was 572, and Senator Sherman has volunteered to head up a working group to look at some of the language, especially the language down around line 24 in that. Senator Sherman?
Yeah, there were just two issues that I think need to be clarified. That line 24 area, we actually do have an amendment that was an amalgamation of Gary Merchant. I think Jenny may have sent it to you all. Gary Merchant and the department, but rather than just trying to do this on the fly, I'd rather have all stakeholders together, and I'd be happy to set that up. The second issue was the one brought up by the two family practitioners, although we lost one of the family practitioners, but I think I got the gist of it, which is with a fledgling vaccine registry, we are the last state in the country to actually implement a vaccine registry. And unfortunately, it wasn't in place when COVID hit, which showed just how important it is. And this bill also illustrates how important that is to avoid multiple vaccinations of the same patient. Senator Bradley, do you have a ceiling issue? I'm just kidding.
He's talking. You saw me looking at something. So
yeah. Anyway, so I would like to tackle those two issues. I don't think it's going to be difficult, but it'd be great to have all stakeholders in the room. And I think that's going to include Representative Merchant, and also Senator Prentice worked on this bill. So
okay,
I'd like to do that.
All right. So the other one that was heard today is 131 and
503.
And 503.
I didn't take any significant notes on 131.
I think we could exec that, couldn't we? Pass that through, or I didn't see any pushback from anybody on that bill.
I need to digest that one more week by myself, but if you guys want to move it, I won't be voting for it. But
there's no hurry on this.
All right, we'll wait a week.
And then the last one, which you were here for part of that testimony, was House Bill 572. And the major conflict seems to be whether or not the executive order and the membership that is contained in that is should be, that this bill should be passed. And
that was 503.
503.
503, excuse me.
So did the department testify, Ms. Santiello?
Yeah, I will say, it sounds like she thought it was duplicative. I don't see it that way. I see as, this is such an important issue. I was happy that the governor moved on it, but this only, puts that in statute. And I do think, because it's such an important issue, just having it be only established through executive order, I think it would elevate it more if it was in statute. We heard, we all received a supporting letter from the Provider Association, Community Behavioral Health Association, NAMI, Waypoint, all in support. So while I appreciate the testimony of DHHS, I do think this is important to put in statute.
Okay. My sense had been, after talking to the department, that we should re-refer the bill, not kill it, not pass it, just wait and, because I'm assuming they said the same thing in testimony, that passing the bill would likely slow down some of the homeless initiatives that are in the works. So, but we can wait a week if people want to think about that.
I'm
Yeah,
good with it though. Jim.
Yeah, I'm okay with acting on it now and supporting it. I'm sort of unclear about how it would slow down the work. It would only enhance and elevate the work by putting it in statute.
Since I am a member of the committee, I would agree with the re-refer right now, that we'll have several weeks if we wanted to send it back to the Senate after some investigation, but the re-refer as opposed to effective on passage, I think gives us some additional time.
All right. Does somebody want to make a motion, or do we want to wait a week?
Let's wait a week.
Okay.
All right. All right. So I do think there are a couple of bills that we can take action on. Not 220. So 600, there's an amendment that Senator Sherman and I have sponsored. If you recall, this was the health screening funding, and we instructed both the advocates for the bill and those that were expressing concerns to go out in a room and come back with a compromise. That's what this represents, to ensure that the funding for the screening actually gets paid, but that the providers felt that they wanted to ensure that it got covered in the negotiations that they have with the hospitals for putting it up. So Representative Marsh, as the sponsor of the bill, I asked him to lead that effort, and this is what they came back with. And there were a broad array of stakeholders that reached out to me to indicate that they were supportive of the bill. Both Heidi Kroll, Paula Minnihan, Taylor Brannon, Representative Marsh. There were probably others that I've forgotten. So, Tom, do you have anything to
Yeah,
add?
I was a part of the discussion. I was in the room with them, the Zoom room. And just for the committee's sake, to clarify, there was some nomenclature issues that made it all much more confusing. But basically, these aren't test strips, it's filter paper. And what we're talking about is not really supplies, but we're talking about tests. And so the key in this amendment is keeping the funding intact for the department to be able to continue this program, which is critical, and making sure that the hospitals have the capacity to include this process in the billing that's reimbursable by the carriers. And I think it was a great job by Representative Marsh and also by all the stakeholders who were there, which represented the carriers, the department, and the hospital association, to come together with this wording that seemed to make everybody satisfied that those goals would be achieved. The program would continue to be funded fully, that the and that the hospitals could include this in part of their billing. And I think specifically Senator Avard's concern was addressed in that there is the capacity. I'm trying to find out exactly where it is, but this does not require fee for service. So it takes into account that can be in I'm just not finding it. But we did talk about bundled payments and being able to have it reimbursed through current rather than going back to a fee-for-service model.
Is that a line 11?
Probably.
Such as fee shall be paid on new.
Yes, shall be without out of, no, actually that's making sure, not line 10 and 11 are making sure that the patients aren't paying for this because that was never the intent of the program. This was, here it is, it's line 8 and 9, Senator. It's nothing in this section is intended to prescribe the reimbursement method or, so that was the compromise there that addressed your concerns.
Thank you.
Okay, any more questions on the amendment? It is 1190.
Move
All right.
on to pass on amendment 1190.
Second.
All right, so it's been moved by Senator Gray, seconded by Senator Avard. I'll call the roll. Senator Sherman,
Yes.
Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Whitley,
Yes.
and I vote yes. Is
Ought to
there
pass
a
the bill
subsequent motion of ought to pass
Ought to
as
pass.
amended? Senator Gray has moved ought to pass as amended, seconded by Senator Sherman. We'll start with Senator Whitley this time.
Yes.
Senator Sherman,
Yes.
Senator Gray,
Yes.
Senator Avard,
Yes.
I vote yes. Is there a subsequent motion?
Move to consent.
Senator
Second.
Avard moves to consent,
Second.
seconded by Senator Sherman. We'll start with Senator Sherman.
Yes.
Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Whitley.
Yes.
All right, Senator Sherman gets the honors on that one. All right. I think we can, let me ask a question. We have not taken action on or have we, on House Bill 479?
Not per my,
Not per my notes. My notes said that Senator Sherman was working on it. And Senator Sherman is muted.
Let me just catch up with you, Senator Bradley. This is 479.
You were going to look into the PA issue.
Yeah, we still have not heard back from the Board of Medicine. So that's
Okay, we'll wait on that another week.
okay. I will try to have that done for next week. Thank you.
All right. Let's go to 605. So
I have an amendment out there that was sent to you guys. I had concerns at the meeting that people who are here for a long term, like college students, and it was also brought up that snowbirds could fit into this, and that they might have a card from another state that is for a condition that is not listed in the New Hampshire law. I compromised and I said, well, we'll give them 3 times within a year that they can go and buy the materials they need. The HHS came back with, well, if they can produce some documentation that they have one of the conditions. So we modified the amendment, and the one you have in front of you is my words plus HHS's words. And I do not believe that they conflict in any way with the amendment that we got from Senator Bradley. So again, I just wanted to offer that to you to make sure that you understood where my amendment came from and the reasons, whether you support it or not. I just still want you to understand it.
I like it.
Griffin, put them up.
Yep. Hold on.
It would be good to hear from the department on this if they're available.
Kirsten Griffin, is Mike Holt?
Yep, I'll bring him in.
available? Okay.
Sorry, I was just getting the thing.
No
on
worries.
screen. Mike, are you there?
Yes, I am. Thank you. Yeah, for the record, Michael Holt, Administrator for the Therapeutic Cannabis Program. Thanks for giving me the opportunity to speak. As you know, this is not department requested legislation. This legislation for the visiting qualifying patients was written by us on behalf of Senator Reagan last year. So that's where this is coming from. You heard me testify on the bill that we don't have issues with this. We think it will provide greater access, greater equity, and a clearer clear law for law enforcement, and to not require those documentation for the same condition, et cetera. I don't share the same concerns that Senator Gray has, although I respect his concerns, and he is correct that the language in the amendment before you does reflect a conversation that he and I had that would compromise on his compromise. The concerns about allowing visiting patients to not have a New Hampshire qualifying condition, I don't share that concern. We know that our list is a flawed list designed by legislators and not medical professionals. Strict adherence to the few visiting patients that come into the state that would avail themselves of the ATCs, I don't think is a great concern for that lack of consistency across New Hampshire patients and out-of-state patients. That being said, the amendment is workable. It could be implemented. A burden would be placed on the alternative treatment centers to require that documentation, track the number of visits by any number of visiting patients that came in, and also track whether or not they had that documentation. I think it's an administrative burden that's not worth the concern, but it can be implemented. The ATCs may have stronger feelings about this. I did share this amendment with the ATCs for transparency. I really appreciate Senator Gray sharing that amendment with me so that I could reach out to the ATCs. So they may be on the line as well, or you may have received separate testimony from them in writing. I'm happy to answer questions that you guys might have.
Are there questions of Mr. Holt?
Yeah.
Go ahead, Senator Whitley.
Thank you, Mr. Chair, and thank you. So the only thing that I'm sort of struggling with, and I appreciate Senator Gray's concern, and I appreciate his time in working through a solution, but I'm just a little concerned that the limitation is just sort of an arbitrary limitation rather than sort of grounded in what's best for the patient. So I am concerned that an arbitrary limit, not based in a patient's needs, would interfere with access. So I just want to know your thoughts about that.
I think any number is going to be an arbitrary number in terms of the number of limits, and for many patients, it will be insufficient. If you take the class of people who have second homes here in New Hampshire and come to visit on a regular basis, to visit their second homes, or avid hikers or skiers that come multiple times per year, the 3 visit per year limit won't be sufficient. Upping it to 12, you might get a little closer to an average user in that small population, but still, it won't be sufficient for those people who come regularly and frequently.
A follow-up, if I may?
Yep.
And I'm just sort of thinking about, Senator Gray's concerns about, are we creating some sort of situation in New Hampshire where, people are going to want to, come to New Hampshire because of, how permissive our program is, but I don't think that's the case, because of our surrounding areas, the access is so greater that, even without the limitations, New Hampshire is not sort of a place that people flock to great access. Would you agree with that?
I would agree. The access in border states to New Hampshire is unrestricted, and so nobody's coming to New Hampshire, to purchase, for marijuana tourism, and I don't think that would happen with the bill as written. The restriction just means that for those people, it's a cumbersome restriction on patients, ATCs, and they'll just not comply. They'll just cross state borders with their cannabis, which is what this bill is trying to protect them against.
Okay, further questions of Mr. Holt?
I would just like to respond.
Yeah, go ahead.
The reason that 3 visits were picked is, right or wrong, I had envisioned that these people would be purchasing the product every 2 weeks. That would be a 6-week supply, which would be ample time to get some kind of documentation, either from their own doctor to fulfill the requirement that that we came to, or to build an association with a medical practitioner here in New Hampshire. Again, I am not trying to make it easy for people to get marijuana that does not meet the New Hampshire requirements. And I don't want there to be a difference between the medical condition of a visiting person and a medical condition of a New Hampshire resident, which is stricter than that of that visiting person. I think it's a disservice to us. It means that our law doesn't really mean anything, and that no matter what, we want you to have marijuana, and that is not the case that I'm trying to put forward.
Mr. Chair.
Yeah, go ahead.
Mike, question about the documentation component of this amendment. With multiple ATCs, how would a person, do they have a documentation system that would let one ATC know that they've used up their 3 visits? Or how would that work?
They do not have a interconnected system. So they would not, one ATC would not be able to confirm whether or not the patient, the visiting patient had visited another ATC. They would be able to restrict those visits within their own ATC. So say, Sanctuary ATC up north runs Plymouth and Conway. They have an interconnected system, but they don't share. And so they would be able to enforce the 3 visit limit amongst those 2 dispensary locations, but not if any visits happened in the other ATCs.
We don't have any idea of the number of people impacted, correct?
No, I have no data on that. Anecdotally, the program hears from the ATCs when we ask these questions that a common occurrence, but again, I don't know how frequent, is, patients calling from out of state, or not even knocking on their door and saying, well, what do you mean I can't, use this dispensary? I'm a medical patient, but I don't have any numbers to share. But we would have numbers to share once the ATCs are allowed to, if the ATCs are allowed to serve this population. And again, I just like to add regarding Senator Gray's concern, I respect it, I understand it, and I appreciate the working out of a compromise amendment that's in front of you. So thank you.
Senator Bradley?
Yep.
Another comment. It was never my intention that the ATCs would have to be the ones that would do that. I would, were I doing this, the ATCs would hand them a standardized note that said that, you know, because you're presenting a card from out of state, you are limited to, you know, 3. And as we discussed in a bill that was either last year or the year before, that data goes to the state anyway, and the state could retroactively look at those records and then contact the individual should they violate that law.
Okay, so are there any further questions, comments on Senator Gray's Amendment 1208?
If I could just float it on, I'm sorry.
Go ahead, Tom.
Just wondering about maybe rather than doing this limitation, putting in a reporting requirement where people who are just starting from ground zero saying, how big an issue is this? If we allowed this to go forward without Senator Gray's amendment, but put in a line in the bill that said that use of ATCs by visiting qualifying patients would be reported to the department and reviewed by the, I can't remember whether it's a council or committee or commission that Representative Knirk heads up and Mike is on. Would it be reasonable to have them do an annual report and then the council could act if there appeared to be any evidence of abuse or a problem?
I think that's a question.
I would be fine with that.
That's also a question to Senator Gray.
Oh, again, you're creating 2 different classes of people. That the requirements for out-of-state people could be less than the requirements for an in-state person. And to me, that's not just. And I'm willing to compromise on my original that the out-of-state people ought not to be certified here in New Hampshire unless they go through the process. I'm willing to compromise on that, give them 3 times that they can go purchase product. And if they are going to stay in the state longer than that, they either need to get the certification from their own doctor or certification from a doctor here in New Hampshire. I understood that this might not be popular with the committee and with the Senate. And that is one of the reasons why I kept it separate from Senator Bradley's bill, is so that there is no undue influence to pass this. And, so again, I'm expressing my concerns. I've done what I think I can do to compromise. I like the bill. And again, it should not be a problem with the people who are dispensing it, because all I see them doing is handing them, a notification that what they can purchase legally, and that the state would look at it, and that would provide you all the data that you wanted, because the state could report back to us, and we can file further legislation if we need to ease up on the program. I would not want to put in an easier program and then make it more difficult later. I'd rather start with the more difficult and then lighten the impact.
I motion to ought to pass on 1208S.
Second.
Okay. Any further discussion? Senator Sherman.
I think I'm going to oppose this. Whatever we do in the bill, I'd love to see that little reporting line in it. So at some point, I think we should go through this, and then maybe we could do a committee amendment if everybody agrees with the reporting line.
Okay.
Could we ask Mr. Holt if this went through, if he would be, you know, the way he normally collects data, would that data be included in there already?
Thank you. Yeah, I think we would have little issue. We would have no issue in requiring the ATCs to collect data on this population. In order for a visiting patient to go into a dispensary and purchase cannabis, we would still hold the ATC responsible for complying with the other rules for the program, including labeling requirements, which currently require a patient's address. It also requires a registry ID, which they won't have, which they should have from the other state. So it shouldn't be hard, I don't think, or shouldn't be impossible for the ATCs to be able to report out on data that they are already going to be entering into their system. And I don't see an issue with the department getting that information, especially at the direction of this committee.
So we don't really need a reporting requirement to get this information. Is that what you're saying?
No, I mean, I would, you know, got the memory of a elephant. We'll do this work based on this conversation.
I don't think
it's going to be a barrier.
To me, this isn't a heavy lift for policymakers, and I think this is something that we can. As Senator Gray said, this is a compromise, and treating out-of-staters with a different standard than those that are in state is not just. And I think this is just a good way of approaching it. It can always be worked out later on if it isn't workable. But I think this is a good compromise, and I think it should move forward.
So I'll just say, I think, you know, like Senator Sherman, I don't think I can support this. I do appreciate your concerns, but, you know, limiting access when this is a medical program for patients is just not something I can support. You know, we do have a big a big part of our economy in New Hampshire are folks that come here, you know, with their second homes. That's a very important, you know, part of what keeps the economic engine of New Hampshire going. So I just can't see providing, you know, putting any additional barriers on those folks with legitimate medical concerns.
So I don't think we need to treat New Hampshire citizens differently than with.
All right. I think we all know where we are on this. Why don't we just? Can
I ask one last question of Mike?
One last question.
Last question, Mike. So you do not need the additional wording to require the ATCs to report visiting qualifying patients access?
I do not need additional language in the bill to require the ATCs to track dispensing to this population and reporting that information out to the department.
Okay. So we have thoroughly discussed Amendment 1208. The motion is ought to pass. We'll start with Senator Whitley.
No.
Senator Sherman.
Get the no's out of the way. No.
Senator Avard.
Yes.
Senator Gray.
Yes.
And I vote yes. So that amendment has passed 3-2.
Motion ought to pass on the whole bill.
I think we need Amendment 1181, which was Mr. Holt's amendment. And that Senator Gray has assured me 1181 and the amendment that we just adopted will synchronize appropriately.
So moved.
Second.
All right, so 1181 has been moved by Senator Avard, seconded by Senator Sherman. I'll call the roll. We'll start with Senator Gray this time.
Yes.
Senator Avard.
Yes.
Senator Whitley.
Yes.
Senator Sherman.
Yes.
Yes. And I vote yes. All right. The bill is now ought to pass as amended. I don't think there are any further amendments, thank God. And is there a motion?
Ought to pass as amended.
Senator Gray has moved ought to pass as amended. And it's been seconded by Senator Avard. All right, we'll start with Senator Gray this time.
Yes.
Senator Avard.
Yes.
Senator Sherman.
Yes.
Senator Whitley.
Yes.
And I vote yes.
Consent.
So here's my question. Senator Whitley, Senator Sherman, are you going to want to divide the question, debate Senator Gray's amendment on the floor?
I would say we should not put it on consent, because if we don't want to do that,
Fine.
someone might, right?
Okay, fair enough. It will not go on consent. I think Senator Gray will take this one out.
Yes, sir.
Fair enough.
Okay. All right, so according to my notes, the only other bill that we might be able to vote on today is the other marijuana bill, the home grow bill, 350. Do we want to do that today, or do we want to wait another week?
Senator Sherman, you have an amendment on that, correct?
Yes, on home grow.
All right, then we'll wait another week.
Well, you should have it, but probably better to wait another week, and we'll send a refresher of it.
Okay,
Just so we'll have it.
I'm good with that. All right, so.
Out of consent.
Wait a minute, before we move out of exec, Senator Whitley and I have been working on a non-germane amendment to House Bill 187. It just came back to me. I don't know, Senator Whitley, if you have received it. I asked that it be emailed to you. And Kirsten should have received it. The point is not to really even debate it at this point, but just to let other members of the committee know. It deals with certification of mental health counselors, which I think, as we all know on this committee, has been a big issue. Senator Whitley and I collaborated on it. It's going to have a separate public hearing next week. If there are any of the, once you see it, other members of the committee, Senator Avard, Sherman, or Gray, that want to jump on as a co-sponsor of the amendment, feel free to let us know, and we'll make sure that that happens when it gets introduced. It will be in the calendar to be noticed. Senator Whitley, do you want to add anything at this point?
I would just add that, the attempt was really to look at something, we've heard so much testimony and, from other stakeholders, what a problem the mental health workforce is. And, it's just such a key to start addressing the ER backlog. And so these are two, important policy pieces to try to deal with that workforce issue. I know Senator Sherman has been working hard on these issues also. And so, I think these are some really concrete, good solutions that are broadly supported by.
Senator Sherman?
Yeah, I would like to be a co-sponsor on the amendment. I also, just to update you, Mr. Chair, and the other members, I've been working with providers along with Senator Whitley at the CMHCs and also the Department of Insurance. And this issue of, I think it was in my bill, SB 70, where there are services that are currently covered and fully reimbursed by Medicaid, but there is no commercial reimbursement for it, commercial carrier reimbursement for it. And when we've met with the carriers, they have repeatedly said that they cover it, just bill it, send the codes. And what we've found are two major speed bumps. The first one is credentialing, and the governor has addressed this, at least in part, by asking for more feedback on bachelor's level mental health workers and the fact that the insurers won't reimburse. And the other one is the one that you all are addressing, I think, with this amendment, which is the idea that or at least it's an issue, is that Medicaid reimburses or credentials the facility, whereas the carriers will only reimburse individual providers. So we are continuing to work on this, and with the carriers saying we will reimburse it, if you bill it, we will reimburse it. We have set up a pilot project with the Department of Insurance where we are tracking all of these billings for at least 3 of the CMHCs. And the commissioner has said that if there is any rejection of those, that he wants to know about it so he can individually review those cases. So that's trying to really get at the heart of what is the problem. And I think your amendment gets us much closer to that. So thank you for that.
Okay, so everybody will get a chance to look at it. If you want to be a co-sponsor of the amendment, if you could let me know early tomorrow morning so I can get your names added and still have it in a timely fashion to notice in the calendar. I think the only other bill that still needs a public hearing is House Bill 143. Is that correct, Kirsten?
Let me just pull it up real quick. I know there was only 2 bills left.
Yeah, and then the other one's 143. So there will be those 2 hearings next week. And then if we're able to exec all our bills next week, that would be tremendous. Okay? But we'll start at 9 instead of 8:30. I think would be fine, hopefully. Okay, anything else in executive session, or is there a motion?
So moved to get out.
Okay.
Second.
Senator Whitley,
Yes.
Senator Sherman,
Yes.
Senator Gray,
Yes.
Senator Avard.
Yes.
I vote yes. Is there a motion to adjourn?
So moved.
Second.
Senator Avard moves, seconded by Senator Sherman. Senator Avard,
Yes.
Senator Gray,
Yes.
Senator Sherman,
Yes.
Senator Whitley,
Yes.
and I vote yes. Okay, see you all next week. Thank you. And Jim, thanks for holding down the effort here. I appreciate it.
Yeah, except for Kevin, I didn't have to scold anyone. Oh,
I'm a problem child. No.
Did a great job, Senator Gray.
Well, I don't know which one of you has the, I think Senator Gray has the bigger beard. So we're you know, taking a kitty here for the biggest beard.
For today.
All right. See you all later. Thank you.